All right, so Carolina, welcome back to the podcast.
Hi, thanks for having me again.
No, it's my pleasure. I've been looking forward to this conversation.
Yes,
Um,
we've been delaying and delaying it.
yeah, thank you for being flexible.
No, but to be fair, like the more time we have to kind of try stuff out and see what's working, the more effective the information, right? Because it's herbal.
Yeah, yeah. So I guess to provide a bit of context, I reached out to you. Um, I guess when everything was starting, ultimately, probably just pre lockdown, maybe, because I thought you would be a great guest to get on to speak about some of the herbal medicine side of things. There's been so much stuff out there from a nutritional side.
Mhm.
Some obviously really stressing the basics, sleep hygiene, and trying to get some physical exercise if you can. And then there's the more controversial stuff around vitamin A and vitamin D and the conversations that have been going on there. But certainly the people that I follow, there hasn't been as much from a herbal medicines perspective. So, do you have an idea of how you would like to kind of start the conversation, I guess? What's a sensible beginning?
So I reckon we should talk about. I've got like I kind of structured in my head what I wanted to say. I wanted to talk about like prevention and mild symptoms, what happens if you get an active infection, and recovery. So like three separate
Okay.
stages of infection. I also thought it would be good to kind of address the cytokine storm disaster that kind of started. But also just kind of thinking about um, ethical considerations and kind of resources and what we can use and like where we need to look, given that supply chains are being disrupted in that. So there's a few things I want to say about herbs, and I'm going to focus primarily on kitchen herbs and stuff we can easily find outside because unless you're seeing a herbalist, a lot of the stuff that I would use you won't and might not necessarily be able to get. So okay, the whole point with herbs is it's always better to see someone trained in herbs because it's not just about taking a herb. We look at the whole picture, we look at the energetics, we look at underlying conditions. So it's basically a science and an art. And I always say to people, when people are like, oh, but my mix is different this time, and I'm like, yes, because it's a different season, or I don't have that herb because there's no stock.
Right.
And I'm going to kind of address what I think are the primary actions that I need to. So I'm also going to talk a little bit about herbal actions and just kind of understanding that. Um, so I don't really want to talk about protocols because I feel like that's like the wrong way to do it. I don't believe people should be buying pre-made formulations anyway. So even when I make like corona support type mixes for patients, they're always individually formulated for the person. They're not like, oh, look at what Stephen Boone has done, I'm just going to take all those herbs and shove them in a mix, which some
Right.
people do. Like people that don't think about the patient. And also, nutritionists recommending stuff that they shouldn't be without knowing, what those kind of potential repercussions are.
Mm.
So, I mean, herbs are being used a lot in China, obviously not here on the healthcare system, but even doctors are being given like a decoction of like cinnamon and licorice and a couple of other things like ephedra as a preventative, and patients are being given that alongside their conventional medicine in a number of different areas of China. So we know those things work well. There's a lot of research on coronaviruses and how herbs work, and because obviously a lot of this research is coming from China. So a lot of the herbs that are used in China, we don't necessarily use here. So, for example, you know, I guess like the different herbal formulations from China that include like danshen and those kind of more Chinese herbs we can use here, but we need to think about what's going more locally to us. So like, and also what are we able to find outside in the heath? So right now, for example, elderflower is coming up, hawthorn is coming up, and even honeysuckle. So honeysuckle is one of the kind of key herbs that's being used in China at the moment for coronavirus formulas, Lonicifera japonica, but we have our own versions of honeysuckle here that have the same kind of medicinal properties. So it's basically medicinal penicillin, and it inhibits viral replication. So as long as you're not using like the fruit, like the berries, you should be fine using honeysuckle. But again, something that you need to think about in terms of like maybe reading cautions, speaking to a herbalist first. But hawthorn, I mean, one of the safest herbs you can use. It modulates everything. It's an ACE receptor kind of modulator as well, so it's not going to have like one action opposing the other. And I guess, you know, the other main point I want to make is sustainability and, like, again, the supply chain issue. What I've noticed in the last month is a lot of people have been panic buying, and like when I'm talking about panic buying, I'm talking about herbalists. So that means that a lot of people who are working on like a kind of a week to week finances as herbalists are really struggling, and they're sending quite, you know, inflammatory messages across groups saying, you know, I can't afford to stockpile. And, you know, I haven't done any stockpiling actually. But I do think that there are certain herbs which are out of stock, like pleurisy root, which is obviously something I would use like as a you know, in kind of a severe infection. Other herbs like that I can't get hold of at the moment are Astragalus, which is, you know, one of the key antiviral herbs, which is also used for Lyme and co-infections. You know, and Baikal skullcap, which is a really important herb and is being researched and kind of touted as a really useful herb at the moment. So a lot of these herbs, I'm just thinking, what else? Atragalus keep selling out. So loads of these herbs keep selling out. So what we need to do is try and find things that we can use from our kitchens and from our local environment, so that we don't have to worry about 6 months down the line not being able to get hold of a specific herb that we need to put in a mix. So that was like, I guess that's my little soapbox thing, is like, don't stock up, don't overbuy. Like bone set example, for example, another one, like, it's just like, come on, there's enough to go around. We can find alternatives if you can't find. So that's like one of the key things. And then just like thinking about making sure that you're using the right herbs at the right time. So do you do tongue diagnosis in your practice?
No, but I've been really curious about doing it.
I mean, for me, when I was studying, like the tongue book, the Maciosa Chinese medicine tongue book was like my worst nightmare, looking at pictures of tongues. I've never seen like a black tongue in real life, but I have seen some pretty kind of interesting coatings. It's definitely something you should get into.
Sounds
like
it.
there's a few books, I think Vasant Lad, who looks at things from an Ayurvedic perspective, and Maciosa is like the dude for Chinese medicine.
Okay.
The books are expensive, but worth having on your bookcase. And then there's a few CPD courses you can do that basically look at tongue diagnosis.
Oh, cool.
But basically, you want your tongue to like be kind of a healthy pink color without being too red. You don't want to have a coat on it. Like a tiny bit of a white coat's normal, but like when it gets thicker, then you know that there's like a bit of an infection there, what we would call there's dysbiosis, and in Chinese medicine it's like a spleen qi deficiency, so it's pointing to a weak immune system. If there's like a red tongue with a yellow coat, then there's like heat. So you can see the difference between like a white coat and a yellow coat. Damp, cold, heat, and that would dictate what kind of herbs you'd use. So puffy tongue with scalloped edges, that's like a weakness in your overall energy. So it's like, or excess is dampness. My tongue gets quite puffy when I'm tired. And when it's really thick, like the coating, it's like there's a lot of what we call in Chinese medicine excess damp. So like mucus, infection, kind of your fluids aren't circulating very well.
Right.
So that would kind of help you decide whether you're going to use like warming or cooling herbs. And I think when you're looking at something like coronavirus, you do need to think, I'm going to match my constitution and my underlying health issues. So yes, we know that the key foundations of health are like sleep, stress management, and making sure that your digestion and assimilation is good. We also need to think about just kind of the whole mucosal immune system in general. So like your eyes, your ears, your mouth, your entire digestive tract. And we know that we use, different probiotics for different things. But yeah, just making sure that your lungs are healthy. So, I mean, the first thing I would advise anyone to do is not smoke. How many people I walk, because I'm coming to the office, I'm driving in every day. I can't believe how many people are out in the street smoking. And I get kind of annoyed when I walk past someone and they're like blowing smoke at me. So I'm like, not only has that probably got your respiratory droplets in it, but like, I don't want to breathe in like your carcinogenic compounds.
Right.
So yeah, just making sure that you're kind of staying away from like pollution of any sort. And the air quality index is amazing at the moment. I'm keeping an eye on it. It's been like 40 the last few days. Last week it was worse. What is it today? 59, so it's gone up since yesterday. So I've never seen it this low in London though. Normally it's in like the hundreds. It's really unhealthy. It was 40 at the weekend when I was on Hampstead Heath and the skies were blue and it was beautiful. And I was picking honeysuckle and hawthorn. And yeah, it's amazing. So this is not a bad time to be able to go out and do your exercise outside, but just stay away from other people if your immune system isn't where it should be. So like one of the things that people are complaining of as like a kind of primary mild symptom is the loss of smell and taste. So obviously, other than doing the zinc, key things I would do to kind of get your sense of smell back would be using bitters. Bitters just generally overall improve like fluid secretions, so that will help with like kind of regulating the mucosal system, gut, everything. So like my favorites are like things like gentian, rosemary. I consider rosemary bitter. I use Swedish bitters, angelica, and also the Ayurvedic herbs. So kind of looking at things from an Ayurvedic perspective. I'm going to like jump between Chinese and Ayurvedic.
That's okay.
I'm not going to go into endobiogenic medicine today though, because I think that's just like going to really confuse people. But like in Ayurveda, the way you maintain your immune strength is like you maintain your routine, which is a dinacharya, and you make sure that you have strong agni, which is like your digestive fire. And it's not just digestion, but it's assimilation and it's clearing of toxins. So ama is toxins. So when you look at a tongue in Ayurvedic medicine, if it's got a thick coat, then that person has a lot of ama in their body. So again, going back to our conversation before we had this call, we were talking about breathing. So maintaining good breathing exercises to kind of ensure that your respiratory system and lymphatics are working properly and you're clearing toxins. Balancing your immunity and making sure that your vital force is maintained. So the kind of simple things that you can take as teas to support your agni and reduce any sort of vata aggravation, which is like most people are vata aggravated stressed. And I didn't, because I'm obviously not going to sit there and look at people and say, I can't do that and say, what's your dosha? What's your primary like dominant dosha right now? How aggravated are your doshas? I just thought, let's talk about tridoshic herbs that are suitable for everyone.
Nice.
Coriander is amazing. It supports your digestion. It's a good antimicrobial. Triphala is an amazing herb. People should use it more. I mean, this is like a primary herb I use for people with SIBO. And it's really gentle. But it's a good tridoshic tonic. And then Bacopa is really good for calming the nervous system and just for everyone. So, I would also use ginger. So grated ginger versus ginger powder obviously depends on how cool or warm you are. I personally think that ginger is good to use with everyone, but I don't use powder because it's quite drying with people that are like very dry, and I don't use powder with people who are already kind of overheated, so like very hit aggravated people. And one of the kind of Ayurvedic remedies or kind of procedures that you do for a kind of viral infection of the chest would be to rub a paste of mustard and ghee onto your chest with some salt, and then wrap up and then wash it off, which is kind of like when I lived in Russia. And when you had like any sort of flu or cold, you basically had to rub vodka and pepper on your chest and wrap yourself up.
Wow.
And so I like these kind of folk remedies, but steam inhalations as well with turmeric and vinegar are quite good. And then like just looking at kind of things that are warming and restorative, so like kitcheries and like aromatic curries. And like, I don't know about you, but chai is like the easiest blend of spice that you can make, and it's like a good preventative panacea cure for everything. So I use like a lot of cardamom in mine because I really like the taste, and I really hate a high clove mix. So you know, turmeric, cardamom, what else is in it? Ginger, coriander. I put coriander in mine. I put a bit of cumin and clove.
Perfect.
So, and cinnamon, lots of cinnamon. So that's something easy that anyone can make. Just kind of, you can, I would not do equal parts because some of them are like overpowering. So just, you know, I put that in smoothies to cover the taste of what's in there. Because my smoothies are not designed for taste. They're designed for like medicinal purpose. They're really, I mean, like, I've outdid myself yesterday. It was disgusting. And like no amount of chai could fix it. But today I haven't even drunk it yet. It's just sitting there waiting to be blended.
Awesome.
Like loads of lettuce, because Riverford keeps sending lettuce and I don't ever want to eat lettuce when I'm cold.
No.
Just, yeah, I feel like, yeah, it's something that they need to think about. It's like, do we really want lettuce every week? I appreciate that, like, we're eating seasonally, but lettuce is just, oh, not, I'm a very cold person. So I mentioned bitters. Do you ever take astragalus like as a herb?
I am at the moment.
Do you eat it or do you put it as a tincture?
We've got it in tincture form.
Because that's a really good one that you can like buy in chunks.
Okay.
You can add and things. And also I like the powder because it's like, so the thing with adaptogens, right, is that sorry, my hair's caught in my bracelet because I'm gesticulating. I always think that if you're doing roots, and like adaptogens are pretty much all roots, you're better off having them as powders because you need like a fat or a it's just much better absorbed as a fat. They work quickly as tinctures, but they work better as powders, like restorative, or capsules. So like astragalus is a really good one you can add to a smoothie or something like that, or a soup, or a kitchery, or a congee, or whatever we make. So the thing with astragalus is it's the best immune tonic ever, but you don't want to take it during an active phase of infection. So this is like this is one of the reasons why I don't use it with people who are like really sick, is because it can basically tonify the pathogen and like, and that's not what you want to happen. So like a lot of herbalists won't use astragalus because it, you know, during active phase. The other thing that I think is like really amazing right now is reishi. Like, I mean, I don't know, it's kind of, for me, reishi is always more of a woman herb than a man herb, and cordyceps is more of a man herb than a woman herb, but I use both on myself like most of the time anyway. And reishi has an amazing history in China of use for respiratory infections. It's also really good for oxygenating the blood, and antihistamine, really good for like the adrenals as well. So I think reishi is a nice kind of good immune like supportive tonic you can be taking at the moment. And also just looking at your culinary herbs, just easy things that you can buy from the shop. Shiitake and oyster mushrooms are really good anti-inflammatories, antivirals as well.
Perfect.
And you don't need to take a supplement to have those because you can just add them to your food. Reishi you can't take as food. It's not. So yeah. So obviously, you know, they work for like your natural killer cells. Just thinking what else. That's another one I wanted to mention that's easy. And actually I have like 4 little cartons of star anise sitting over there because I'm going to soak them and make some weird potions with them, and like honeys for later. I'm not actually recommending any honey based products right now because of how honey basically is kind of stimulatory on the pancreas, and like that's gonna, you know, pancreas and lungs are linked in endobiogenic medicine, so it's gonna support congestion of the lungs. So everyone else is banging on about, hey, make some fire cider right now, and I'm like, no, because that's got loads of honey in it. Why don't you just make a nice vinegar instead? So that's my advice. So star anise, beautiful. Don't know if you've ever drunk star anise tea. It's a bit like drinking medicine. It's kind of amazing.
No.
So go to the next time you do an order online, get some star anise from the health shop, or you can get Elysium, Supreme Nutrition Elysium. Anytime anyone gets sick, you can take like 8 or 10 a day, and usually your virus goes. But it's got the shikimic acid, which is the precursor molecule for Tamiflu. So although it's not going to be like, hey, this is going to cure coronavirus, it will help because it has those antiviral activities. And also because, of course, we know that herbs work differently to medications. Elysium has other things that are really effective against viruses and antibiotic resistant strains of bacteria. It's also really good against malaria. So
amazing.
This is again where herbs trump many drugs. Oh my God, I just said the word trump. Sorry. Not suggesting we drink Nettle. So elderflower and elderberry. Did you want to talk about the elder? I mean, I feel like there's a lot of literature on this now, and how, you know, when that first came out, I was in India and I was so annoyed reading all these people panicking about elder and like berating all of the health shops for having elder syrup on their shelves. I was like, well, actually, you know, this is a classic case of someone reading a study and completely misinterpreting it. And that was a big thing in all the functional medicine groups back in March. But it's basically someone read a study which showed that what did the study say? I can't remember. But it basically it didn't actually say that there was that it triggered a cytokine storm. There was no suggestion that that happened, but there was a reference to like pro-inflammatory cytokine activity increasing after taking elderberry extract. And so someone read that and thought, okay, yeah, this is bad because it will induce a cytokine storm. Okay, I mean, obviously the difference between herbs and drugs is that herbs have multiple actions and don't just work on single pathways. And I mean, I have this argument every day almost with oncologists and pharmacists and hospitals who are like, you can't take that because it's going to interfere with your drug. I'm like, no, it won't. I've checked all the interactions. So yeah, it does get quite draining having to have this kind of constant ongoing battle with doctors who don't understand how herbs work. They don't, you know, people that don't work with plants on a daily basis, you know, don't really understand the mechanisms. And I don't really think that, you know, there are people out there who kind of point blank saying that we shouldn't be taking these things, or, you know, on the BBC that taking garlic is not going to help you. It's just, no, you don't understand. You know, I appreciate everything that doctors are doing for us, particularly, you know, at the moment with the NHS being so overloaded in this country. But I think that whatever, all the work that we're doing as practitioners, you know, functional medicine, naturopaths, nutritionists, coach, whatever everyone's doing, you know, we're effectively helping to reduce the burden on the healthcare system and encouraging people to take a more proactive and preventative approach to their health. So I think that we need to be kind of, you know, I don't know, we should be respected in the same way that we respect our healthcare providers.
Right.
Do you think people understand the cytokine storm? Should I explain that?
Yeah, it might be worth kind of touching on that, because I guess there are going to be quite a few people who might be familiar with the term now, but don't necessarily have a sound understanding of what we're actually talking about.
Okay, so effectively, our immune system has we have a constant state of flux in our immune system. So that's the process of immunomodulation. So cytokines are chemical messengers which communicate with each other, and these are important for our immune response. So they're basically coordinating a systemic response. So when our cytokines are functioning properly, we respond appropriately, and our body learns from whatever we're dealing with, and we deal with it better next time. When we get into a cytokine storm, it's basically when we get uncontrolled inflammation, an uncontrolled release of cytokines, and an uncontrolled cytokine activity, and the body basically just doesn't know what to do with itself, and we can't then fight back against the cytokine response. We need to modulate it. So in the coronavirus cases that we're seeing, the COVID-19 cases, when the body goes into panic mode, we're seeing inflammation, kind of fluid filling the lungs, and temperature going through the roof, and inflammation. So that's kind of beyond our expertise and kind of remit to deal with. That's like ICU territory. But certainly if we can prevent that happening and support our first kind of line of defense against getting to that point by helping our bodies inhibit viral replication early, that's where we want to be kind of supporting our patients. So all of the stuff you said about lifestyle, and just making sure that you're taking the right nutrients, and then maybe some of these herbs. So I actually think, like, the way I see things, I don't think that we should ever do herbs as individuals. I think it's better if we mix herbs and make them up as blends. So elderberry is not going to induce a cytokine storm. It's not going to send you to hospital. It's got a ton of amazing flavonoids that are really useful for the ACE2 receptor, like inhibiting binding of the virus to ACE2 receptors. It's got antioxidant activity. It's really nutritive. It's full of quercetin. I always say it wrong. So, I mean, there's different parts of the elder tree. Matthew Wood is basically saying that we should be using the leaf, but that's like a really horrible, I never use the leaf. It makes you sick. Like, it's a good purgative if you want to vomit. But it's not something I ever use in my practice, unless it's topical, in which case I make ointments and it's great. I use the flowers and the berries, and yeah, that's it basically. No leaves, no bark. So the flowers and the berries are both antiviral. They have a diaphoretic effect, so they promote sweating, so that you can it speeds up the clearing of a respiratory infection. They've also got antispasmodic activity. So, I'm thinking about what I would put in a nice tea. I would probably put elderberry, citrus peel, because that's really good for opening up the airways. I mean, in my practice, I'd use ephedra, which is a Schedule 3 restricted herb, to open up the airways in an acute situation. And I have used that this past month with a family member who couldn't breathe and, who couldn't get to hospital because the wait time for an ambulance was like 3 hours. So I preemptively dropped off some ephedra, like as a simple, next to their other herb mix, and that worked really well to kind of prevent a need to go to hospital. But I would probably not do that with a patient, because I would be like, you need to go to hospital, you need to speak to your primary care provider. But in this case, family members can kind of do whatever. They're like my guinea pigs, aren't they? My husband and my family are just constantly being bombarded with weird herbs. So yeah, I would probably be thinking, oregano, rosemary, garlic, thyme. And these are things that we can also, kind of make infused oils with, so that we can have them every day in our salads, on our food. I mean, I don't know, do you ever do that? Make vinegars and things and
yeah,
oils? Really easy. You just need to shake them like twice a day for a month.
Right.
So you fill a container. So like Oh, no one can see.
I can see.
You can see. So, for example, if you have a jar, you fill the jar full of dry herb or fresh herb, bearing in mind that fresh herb has got a lot of water in it. So I would really like shove that down, pour the vinegar or the oil over so that it's really properly covered, and then just twice a day shake it. Bingo, a month later. You can also heat it to kind of speed it up, but you know that's probably what I would do now because we're in the middle of a pandemic. But otherwise, generally, you leave it a month, you know, shake it twice a day, then you strain it, and then you've got your infused oil. Or if you want to keep it looking pretty, you leave the rosemary and stuff in there, but it does look a bit manky after a month. So yeah, those are really easy. Making a kind of vinegar with like garlic and horseradish and onion and chili, lemon peel. The peel in the lemon is way better than the lemon. Oregano, thyme. What else is there in the kitchen? Clove, ginger, rosemary. Yeah, all of those.
Amazing.
Any of those kind of volatile oil, anything that smells good, like and has a really strong fragrant smell, is basically got loads of volatile oils in it, and those are the antimicrobial, antiviral elements of the herb.
Okay.
That's one of the kind of classes. You've also got the kind of the licorices of the world, which have got loads of saponins, which kind of are good for like getting mucus out, but are also really antiviral. Oh, I need to stop talking for a minute. Oh, shut up! Wow.
Amazing.
So yeah, I'm just thinking what else would be good, you know, in terms, so teas, steams. I use an essential oil diffuser in my house, so like a nebulizer that doesn't require dilution of the oils. I actually always have one in my office when I have patients as well, because you know, if they're sick, not that I'm seeing anyone in the office at the moment, but you know, just generally if someone comes in, you know, because we're working with Lyme patients, mycoplasma patients, these things are quite contagious. So having an essential oil diffuser on, being very careful if you have pets to make sure that those oils that you're using aren't toxic to animals. But if you have any mold in your house, it's also really good. So also, you know, the things that are really effective against, well, there's one particular compound I can think of that's really effective against coronavirus, this particular COVID-19, and is government approved in the US. Compounds, you know, products with thymol in them. So thymol is kind of a compound that you find in oregano, thyme, and lemon. Rosemary less so, coriander less so, and savory, which is a herb I use a lot in endobiogenic medicine, but isn't used a lot in Western medicine. So weirdly, you'd think thymol would be really abundant in thyme, but it's actually more abundant in oregano. So I'm actually telling my patients not to, you know, I get them to rinse and soak everything to remove pesticides, but at the moment, because everyone's obviously having their little freak out about, you know, people touching stuff in shops, and rightly so, although I don't believe the virus will sit on a lemon for 2 days without degrading with people, you know, maybe. But you know, if you're buying fresh produce and you want to wash it properly, you can add a few drops of lemon essential oil, which is totally safe to ingest, like to a big bowl of water, rinse your products and then rinse it off.
Okay.
As a way of kind of making sure that you're clearing the virus. I'm also using that, you know, on floors as well as a cleaning thing in my diffuser. So that's something else to think about. Awesome. And then steams. Are you nebulizing anything?
No.
I get a lot of people to nebulize, but I'm a bit wary of the glutathione nebulizing, just because in my experience it can cause quite bad vasoconstriction.
Okay.
So I'm not a huge fan. I had a big chat with someone about this the other day. He was like, we should be nebulizing iodine. And I was like, oh. And also people can find it quite irritating. And at the moment, I'd rather make sure that the lungs were like not irritated. And okay, so what was I thinking? Yes, other useful herbs that we can find outside. Nettle, plantain, and dandelion. Everyone knows what nettle looks like. Everyone knows what dandelion looks like, but plantain, there's lots of herbs that look similar. So don't go picking unless you're sure.
Okay.
And there's loads of wild garlic around at the moment, which is lovely.
Brilliant.
Lovely for wild garlic pesto and things like that. I wanted to touch on berberine, because I think that's something that nutritionists do tend to recommend a lot. So one of the things with berberine is that if someone has a G6PD deficiency, things like berberine and ginkgo can have, and vitamin C infusions can have a potentially harmful effect. So there are certain drugs and things which, with people with G6PD, can trigger hemolysis. So that's something I would just check if you're giving someone berberine, maybe check if they have that, or just monitor their blood work. I would say don't prescribe unless you know what you're doing. But it's one of the really effective herbs against this virus. So like berberine, so berberis, like vulgaris, Oregon grape, and Coptis golden thread. So those are a really nice berberine containing herbs, but I think there's that caution around that. So don't, and it's something that people use a lot for SIBO.
Yeah.
So I think it's really important to just bear that in mind if you're recommending stuff. Is, you know, if the patient's not doing well on it, maybe think about why. What was I thinking? Oof, what do you think?
I'm thinking that's a lot of information, which is really helpful.
Well, we know about elderflower. We know about echinacea. Everyone loves that. Great for immunomodulation. We talked about honeysuckle, but I'm like, yeah, don't go picking the wrong bits. And like, there's some really, again, all of these amazing expectorant herbs like selling out as well. So inula is an amazing herb for like keeping the lungs clear and like getting phlegm out, but it's really hard to get some now. I mean, I've got some, but not a huge amount. So it's just like, yeah, I wouldn't recommend the public go out and buy loads of inula. But licorice, you know, that's a really nice, easy one to boil with cinnamon and thyme and stuff on the stove, and like, you know, have a nice cup of that every day. It's really easy to do.
Perfect. And
then just also, like, we've also got the idea of herbal baths, you know, putting stuff in the bath with oil so that you kind of absorb. And then you've got like a whole kind of double whammy of having a steam. So any of the diaphragmatics, so like elder, yarrow, garlic. Well, I wouldn't put garlic in the bath. Ginger. Yeah, lots of those.
So literally just throwing some ginger into the bath.
Yeah, but I mean, the way I get people to do stuff with baths is put it in an old pair of tights.
Okay.
Like, for example, if someone has like eczema or anything, oats in an old pair of tights dunked in the bath. Really good for like calming down the skin. But it's just a nice way of kind of ensuring that, you know, you've got to think about your relaxation and your stress response as well. I think that's another thing, is like, I've just written another article for Integrative Practitioner about social isolation and what kind of stuff is coming up, the challenges. And I'm seeing like people, I see a lot of people with addiction issues anyway. So how to navigate around that when I can't see them face to face, is a bit challenging. You know, there's a big difference between people who have a support network and people who don't. So, you know, making sure that people are staying connected the best way they can. But then there's also people who love what's happening at the moment in terms of what it's like, you know, them not having to go to a physical office, working from home in isolation, not necessarily feeling the pressure of social engagements. But I would say, you know, this is quite a difficult time for kids. Which brings me on to my next point, you know, things that you should use for kids. Again, immune tonics, you know, you can use your Astragalus if you want to, you know, add that to soups for the whole family. But I think, you know, elder, chamomile, calendula, like, you know, your lemon balm, your verbenas, just things that kind of help them kind of feel less stressed, because, you know, just seeing how my sister's kids are handling this stuff, it is a massive shift to have to go from seeing your friends every day to being stuck at home, being a bit bored because your parents have to work. There's a lot. And then you've got, elderly people who don't necessarily have family around them, people worrying about job stability. So I'm like, suggesting a lot of lovely nervines at the moment for people. Passion flower, California poppy, those are my favorites.
Nice.
I like Codonopsis as well, but that's not really something that people use in the UK, but that's good for the heart as well. What else? Yeah, skullcap. So Baikal skullcap, we don't really, that's a really good one for the antiviral properties, but if you can't get hold of that, Scutularia laterifolia, which is more of a calming herb, it's got some of the same benefits, but not quite as many. So I don't know if that. And then I was just thinking also about like key compounds that are useful. Like we know about quercetin, everyone's talking about it. So like all of the foods that have quercetin in them, like apple, onions. There's also betulinic acid, which is like the primary like triterpenoid in licorice. Oh no, sorry, it's not. It's the primary triterpenoid in ginseng, Siberian ginseng, eleuthero. It's also present in chaga and birch because like betulinic, betula. That's really good antiviral, and it's like a nice anti-cancer agent. So a lot of the stuff that I would use for cancer, like the compounds I'm looking for, are really useful here as well. Because it just completely wipes out your white blood cells. Like I think I was saying to you before, it's like a weird kind of combination of like dealing with cancer and like almost like a really resistant Lyme infection, but obviously different mechanisms of action. But it's like that level of kind of, it's really hard to shift. I've seen people kind of go through waves, feeling better for 2 days, feel crap again, feel better. It goes on for 3 or 4 weeks. But I think, thinking about restoration and like what you use afterwards. Oh, the other thing that's good is Camphor Oil. It's like a compound that you get in like loads of different foods. So like lettuce, cucumber, all of your cruciferous vegetables, onions, apples again. So, apples are a superfood right now. Cinnamon's really good, but Rapunticum is one of my favorite herbs for people who are like really wiped out. So obviously when you're in recovery stage and you've had the virus and your lungs are like completely shot to pieces, you want to start thinking about your adaptogens, like your Rapunticum, your ginseng, looking at how you can restore your lungs. So again, inula and Codonopsis again. So that's something I'm kind of helping people with now. Obviously I don't touch the acute phase, like where it gets deep and they have to go to hospital. I will herbally support people who are looking to prevent, or if they've got mild symptoms and they've been told to quarantine at home, but I won't go near anything that's like hospitalization level, because that's completely not what a herbalist is meant to be doing right now. But when they've come out, if they've come out of it and they're like, Caroline, I'm really tired, or they've still got this niggling cough, that's when we use like the tonics. Obviously vitamin D is really important for like maintaining your immune system. That's just, there's been loads of weird like just kind of different opinions on that. But yeah, oh gosh, I feel like I need to. I've just talked. I haven't let you talk at all. Sorry. I feel like one of those selfish friends who just talks about
No, that was the plan, to get these things out your brain.
It's like a robot. I'm like,
no, that was amazing. I think the great thing is there's so much that we can do from a practical perspective with things that we've probably already got in the home, which is amazing.
Yeah, absolutely. So mustard seeds in your cooking. Fennel's a really good one, for obviously for digestion, but also it's a sertrogenic herb, so it's good for your mood without really, doing that much to improve your mood.
Brilliant.
So there's loads of those. I mean, I think that you can kind of get away with using what's in your kitchen. I think it's a good time to start thinking, right, I've got all these things in my cupboard. I can do something with them. I can make a weird like concoction in vinegar, or I can make an oil. But I think just, experimenting with what you can kind of provide your kids easily, like teas, add stuff to food. It doesn't have to be complicated. So I guess, thinking about I wanted to briefly touch on classifications of herbs, because some of these words people might read about, but they might not know what they mean.
Okay.
Adaptogens, obviously think stress resilience and restoration. So licorice, tulsi, ginseng, astragalus, like there's some key ones. Raponticum, which is my favorite, and ashwagandha. Some like stuff for pain relief. So willow is amazing because salicylic acid, aspirin, willow.
Okay.
Things like meadow sweet, which looks like a big daisy, even cayenne pepper. I use that a lot as an oil, in an oil. Things that help with catarrh, so like marshmallow root, so when it's a root you need to decoct it, so you need to boil it on the stove for 10-15 minutes. If it's like a leaf, you just make a tea by infusing it or blending it, or add it to a smoothie, like just blend the leaves fresh. So you want your kind of echinacea's good, licorice, elder, berry or flower. Mood support, lavender. So this is where, if you don't want to take it as a tea because it's a bit like eating, I don't know, Marks and Spencer's talc from the 90s. Things like lavender in a nebulizer for the room, bacopa, which is something you can usually buy in health stores now. Chamomile is really good for mood, rosemary, anti-inflammatory. So I mentioned birch before, garlic, turmeric, frankincense. Again, I use that a lot in an infused oil. So think about if you've had a chest infection, rubbing infused oils on your chest. Chamomile, what else? Ginger's good for an anti-inflammatory. Then you've got your antimicrobial, so anything that kills bacteria, because often once you've got a virus, you get the reason you get sick is because you get a secondary infection, and that's why people get bronchitis. So just basic stuff: thyme, oregano, echinacea, garlic, even lavender. Those are really good. Things that help if you get spasms, chamomile, mint, thyme, parsley, ginger. Things that help if you've got too much phlegm, so drying out the mucous membranes. Agrimony, which is good as a tea. Green tea is good because you get that kind of tanniny taste afterwards. Black currant, I use a lot of black currant, raspberry and strawberry leaves in my practice because of the endobiogenic stuff, but really good, lovely astringent kind of properties. And rose is very astringent as well, like the flower. Bitters, again, for your improving your secretions and kind of getting your smell back. Yarrow, angelica, berberine, compound herbs. Artichoke, yellow dock, dandelion, grows everywhere, makes salads. What else? Again, California poppy, so it's a bitter and it helps calm you down and make you happy and maybe sleepy. Things that kind of help with spasms, again, carminatives help with wind as well. Fennel, cinnamon, coriander. Demulcent, so if there's like a dry tickly cough, you want to have a demulcent to kind of soothe and help the area heal. So again, marshmallow, licorice. These are really good boiled and like then drunk. Slippery elm powder, which I hate, but just it's very good, but it makes me so sick. I'm like the rare person who reacts badly to valerian and slippery elm. Plantain, which is if you put it in water, it kind of turns into this like gross slimy mess, but it's an amazing herb. Plantain is like one of the best anti-inflammatories out there. And then, you know, you want to support your liver through all of this. So like anything bitter will work for that. So again, dandelion, artichoke, agrimony. Immune support, go outside, look at the sticky willy cleavers growing everywhere. That and your plantain and your red clover and your echinacea. Those are all really good actually. And then, you know, what else do you need? Yeah, if you've been sick and you want to build yourself back up with nutritive herbs, alfalfa, nettle, oat, dandelion again. It's interesting because when I think of nutritives, I think what's safe for pregnant women. I wouldn't use alfalfa necessarily, but I'd use all the others. Stimulants, so like stuff that will kind of get mucus out as well. Horseradish, mustard, cayenne, black pepper. So all of these things you can rub on your chest with ghee, or you can do foot baths. You know, mustard foot baths are amazing for kind of getting them out. There's a doctor in France. I remember when I was doing herbal medicine, my herbal medicine training, and we were taught about a doctor in France who does 7-minute foot and hand baths, and that's it. That's his treatment. So
Really?
I was like, I've done a lot of foot baths on myself, and I get patients who don't have baths to do Epsom salt foot baths as well. So any of those kind of volatile oils. And then, yeah, we talked about immune tonics. You know, think about herbal kind of cardiovascular tonics, so hawthorn, adrenal tonics, so like your ashwagandha and your rhodiola. Yeah, I think that's all of the relevant herbal classes that I wanted to mention as well. I guess if you want to think about mood support as well, skullcap, Melissa's really good. There's a whole thing about, you know, inhibiting thyroid, but it's actually more of a herb that kind of works on the interplay between your TSH and your TRH.
Okay.
So interesting. Did I mention last time that our TRH is like the most poorly like observed hormone there is? Like no one talks about
really?
it. I should do a post on that actually.
Do it.
Yeah, it's because we can't measure it very effectively in the blood. It's kind of it's kind of white. People just forget about it.
Yeah.
That and osteocalcin, which is one of my favorite things to measure in blood, but that's a conversation for another. I could just go on forever, couldn't I? Oh my gosh, I'm exhausted now. I don't talk that much normally. Normally I'm listening to patients talk to me.
This is what they feel like. No, it's
No wonder people are like, I'm exhausted after our session. I'm like, I always like it's the emotional release, but actually it's just talking.
well, you know, we mentioned off air that I'm reading The Oxygen Advantage at the moment, and he uses an example of like teachers, for example, who or anyone who in their work talks a lot, and how one of the reasons why we always feel exhausted at the end of like a clinic day or something is potentially because we are just talking, and that's having such an impact on our kind of oxygen carbon dioxide ratios from a breath perspective, which is really interesting.
Yeah.
So having those little pauses just to
breathe.
To breathe, yeah.
I do deep belly breathing quite a lot during the day, and usually between patients, and I do the heart math a lot, but it's, you know.
Yeah, so Patrick McKeown's point is a really interesting one because it kind of goes against some of what we think. So one of his points is, you know, when we're taking deep breaths in, we aren't reoxygenating ourselves. We're kind of doing the opposite, because it is, I hopefully will get this right. It is certain brain receptors that are kind of monitoring our carbon dioxide status, which is influencing our needs to breathe, and also influencing the amount of oxygen that at a cellular level we're utilizing.
Yeah.
So his whole thing is actually we're over breathing, most of us. And he's got some really interesting little exercises that you can do just to get an idea around this. So it does kind of go against some of what we almost naturally do, you know, the idea of taking a deep breath in, which might be helpful in some ways. It might help calm us down and things. But actually, if we're thinking about other elements of health or physiology, it's a really great book.
isn't this just another kind of looking at kind of how to biohack, making your body more resilient? This is all your resilience thing, isn't it?
Well, to some degree, yeah. I mean, one of the components of physical resilience is kind of hypoxia. And you can induce that, I guess, through a degree of breath work and through exercise ultimately as well. So it will build resiliency, and it will help from an oxygenation perspective at a cellular level, but also sort of performance. So what I understand so far with his work, it is more kind of performance orientated. And like, again, we said off air, then you've got kind of transformational breath work and loads of other forms of breath work, which is maybe a bit more spiritual and healing from more of a holistic sense.
Yeah. Yeah, it's interesting. I've done both. I've done like hypoxia treatments and I've done like hyperoxygenation treatments. I'm interested. I actually really want to get a hyperbaric chamber, but
Wow.
I'm waiting until this pandemic is over, if it will ever be over. We have to find a new normal now, I think.
Yeah, I think so. I was speaking to I think he's a gynecologist, and he's been doing a lot of kind of telephone consults for some of his follow-up clients, kind of saying how it's actually worked really well and how he can see it being a part of how him and his colleagues and similar consultants start practicing in the future, partly because it's been shown to be effective. It's working for them. So I
Yeah,
think it's
no,
going to shift a lot of things.
I mean, I already do a lot of like I can do neuro exams over video. It's not an issue. Like there are certain things I can't do. Like when I do my endobiogenic physical exam, I can't palpate like the whole pelvic, the gut area. That's a big part of the kind of diagnostics. But with endobiogeny, we also do a lot of physical kind of assessment based on like the shape of someone's lips, eyelashes, little things like that. So there's a lot to do with temperature and like texture and consistency, but and also just where there are pain points within that palpation that
Right.
you do like a kind of exam. But neuro exams where I'm asking patients to kind of close their eyes and march and do stuff on one leg, you can do it all via video. So I think it's not gonna, it hasn't significantly affected my practice. There are certain practices I can't do, like the frequency specific microcurrent. Obviously I'm not seeing anyone in person, but I'm doing ear acupuncture remotely as well, so
Wow.
self-directed, with not with needles but with magnets, and that's working really well for people.
Huh.
That's
Excellent.
something I just thought, we have to be able to do this. We have to, because this is an integral part of what I would do with addiction.
Okay.
So yeah, it's been interesting, the shift, how your practice has to adapt.
Yeah.
But at some point I want to go and live in the desert anyway. So I'll have to be able to work from anywhere. Yeah, just
dreams coming reality.
at some point, yeah.
Yeah. And, that's the whole, I guess, the whole concept of resiliency, isn't it? The ability to adapt. So it's getting our businesses as resilient as our bodies and minds.
Yeah, and also I just think it's really important to think about what you enjoy doing, not just what you do to live and survive. But if you don't do things that you really love, then you don't thrive. I think diversifying what you do, I don't see patients 100% of my time. I work on consulting projects. I formulate products. I'm working on something else. So I've got this mental health initiative I'm doing. So there's lots of different kind of things I'm doing, herbal stuff. And I think that's really important if you need to make sure that you kind of don't fall into a rut.
Yeah.
All the learning, can't ever stop learning in this job.
Yeah, no, absolutely. And I think you can either go down sort of one specific path potentially, or sort of branch out in some different modalities or different forms of therapy.
Yeah, I've always just thought if you narrow things down, then you miss stuff. That's why I've never specialized in anything. Like I
Yeah,
have areas that I focus
no,
on, but
I'd agree. I think we run the risk of going down more of a conventional route if we start to specialize too much. And I think also, like everyone has said before, we just start to see everything through that lens. So it's
yeah.
a tricky one.
But that
But
also happens when you learn and you do.
yes.
Like when I was in New York in February, I did a day with Mark Houston, um, and it was all about HDL function, and it was amazing. It was like, oh my god, all the stuff we know about the heart and cardiovascular health has kind of been turned on its head. And it's very Regina, the cardiologist I work with in America. I very rarely see her like think someone's good. Like if I'm like, oh, I saw this. There's always like, for her to say, yeah, that was really interesting. And I was like, good, because it blew me away. And so that's like, it's almost like when stuff like that happens, it makes you realize that like you have to like it completely destabilizes your learning, and then you have to keep on top of things. Like, yeah, so that's been an interesting one.
Amazing.
Just remembered that, and I was like, I feel like my cardiovascular knowledge has to take another. I have to spend a lot of time learning more around that, waiting for the test that doesn't exist clinically yet to come out to be ready.
Right.
But yeah, that was thinking about that.
Yeah, it's a never-ending journey, and I think that's where, to a degree, there's got to be an acceptance that we're always going to be essentially playing catch up, I think. And I've spoken to quite a few colleagues recently who, I think quite easily and rightly feel a bit overwhelmed by the amount that they feel there is to know and to learn, and how you never really make an indent in it. But it's reframing it to enjoy that process, I guess.
Yeah, but I mean, just thinking in contextually about COVID-19 and the amount of stuff coming out about it, the amount of people who've got their platform and stuff, it's like you have to, and oh my God, the amount of fake stuff and scandalous like opinions around everything. I'm not even going to go into detail, but it's like sometimes you just have to switch off from it, and you have to like look at like that's why I was like, okay, I'm going to look at the literature, but also what works, what has traditionally worked thousands of years
Right.
ago, these things, what are these energetically, how are things going to work, rather than being like jumping on a formula that's being used. Take a step back, think logically about how you would approach it, like, and leave the kind of acute distress cases for people who are trained to do that. Although to be fair, I'm not 100% convinced by a lot of what's been happening, the treatment options available to people. Very lucky that no one I know has had it seriously. A few people I know have had relations die. I read a horrifying article in the New York Times about a man who was perfectly healthy, lungs completely complete white out in his lungs. So I just think, we can have this conversation now, but in 2 months we could have a completely different conversation. And that's why I was like, it's fine, let's not do it straight away. I don't want to say something that I'm going to be like, oh my God, I can't believe I said that.
Yeah.
And I think there's a real risk of that. And there's loads of people making comments about vitamin D and then backtracking. And it's just like, don't, if you don't know, don't do it. Like, if you want to talk about what works for you, great. Don't expect everyone else to have the same effect, positive.
Yeah, no, absolutely. Brilliant. Carolina, is there anything that you would like to finish with? Anything that's come to mind that you haven't yet mentioned, or anything you want to reiterate?
I would say try and work with a professional, unless you're using kitchen herbs. But just even bear in mind that even with those, there can be some, potential interactions. So it's always worth checking and like getting something made for you. Unless I really think that people need to refer more to herbalists. People who are
Yeah.
trained.
So that kind of leads into the final question I have, which is, I know you're incredibly busy already, so you might not want to give people your contact details, but is there a resource people can go to find a qualified herbal medical practitioner or something like that?
Well, there's a few different associations. I mean, that's always a good way of looking. You can look at the schools. The CNM have a good herbal program. But yeah, there's a few different associations out there. I'm actually not a member of a UK Herbal Association because I don't really think they're very good. I will say it. But and also some of the advice I see, it's I just don't feel that the training, you know, people are giving advice in nutrition, and there's just kind of an overlap where the advice isn't effective, which is why I keep saying refer. But I think a lot of nutritionists, for example, do work with herbalists in their areas, and you know, if someone's working with someone, that's the best way to find it. In terms of like good advice online, I would say Rosemary Gladstar is one of my favorite herbalists.
Okay.
Annie McIntyre is awesome. Matthew Wood, Stephen Booner. Yeah, and I regularly write stuff about herbs on my Instagram. I like focusing on like medicinal uses, chemistry, and mythological and astrological stuff because I think that stuff's interesting. But yeah, there's loads of really good, like the Herbal, the Alchemist Kitchen in New York is one of my favorite shops to go to when I'm there. There's loads of really great resources, like on Instagram actually.
Okay.
I mean, I would probably like for kind of kitchen knowledge and like day-to-day stuff, that's where I would look.
Amazing. Excellent. Well, thank you.
Rosemary Laforêt also.
Rosemary Forey.
Rosemary Laforêt. She's done a really nice book about herbal teas, so that's a good.
Okay.
For people who just want to kind of do their own thing at home, and I think a lot of people will be doing that one now.
Yeah, hopefully.
Yeah.
Brilliant. Carolina, thank you so much for sparing some time to come and chat again.
Good timing. I've got a patient very soon.
Excellent.
It's good to speak to you. I'm sure we'll chat offline anyway. So.
Yeah, definitely. We'll catch up soon.
All right, then. It was lovely to talk to you.
You too.
See you soon.
Yeah. Thanks, Carolina. Bye.